Welcome to Learn Idaho's presentation, Improving Bathroom Safety for Family Caregiving. My name is Dara Ray. I'm the president of Learn, and I am delighted to welcome Consuela Marshall from Finding a Foothold, our guest educator for today's presentation. Please keep in mind that today's content is provided for general informational purposes only and is not to be considered legal, financial, or health advice. Please consult with your legal, financial, healthcare, or other service providers before taking action based on this information. It is truly my pleasure to welcome Consuela Marshall from Finding a Foothold to join us today as our guest educator. Consuela is a caregiver coach and consultant who I had the pleasure of meeting at a conference in Virginia, the CARE Colloquium, where care leaders from across the country came together to share information and see how we could help one another. And it was my greatest honor that Consuela agreed to be with us today as a guest educator. Consuela is an occupational therapist with 27 years of experience providing care to individuals with disabilities and disorders or who have sustained injuries which negatively affect their level of independence with self-care, mobility, and their activities of daily living tasks. She's a graduate of Louisiana State University Medical Center, and she has worked on skilled nursing units, in inpatient rehab units, as well as in the home health setting. Consuela, thank you so much for joining us today. Is there anything else you'd like to tell us about yourself before we get started?
No, thank you so much, Dara, for having me here. You've covered it all, so I really appreciate the opportunity. I'm here today to share some insight on improving bathroom safety for both the person being cared for and the person that is caring for them. And according to statistics here, that 80% of the falls that occur in the home happen in the bathroom. And that equates to over 200,000 seniors going to the ER as a result of an injury that has occurred in the bathroom. And of those that are eventually hospitalized because of that injury, that number is 30%. And so as a home health occupational therapy, I get to see those 30% that come home after having had maybe a hip fracture or some long bone break, a joint injury, or just some type of a head injury, Dara, that has occurred when they hit the floor, fell in the tub, or just lost their footing and had an injury in the bathroom.
80% of falls at home occur in the bathroom. This is important stuff.
Yes, yes, it shows that of the falls that are happening, the bathroom is the place that really a lot of caregivers need to take a big look at.
Well, let's
See
look at
what they can
it.
do to lessen those incidents from occurring. So yeah, it's a big problem that happens quite a lot. And to sustain a injury like a hip injury, a hip fracture, a knee fracture, a head injury, those are life-changing injuries.
Yes.
And unfortunately, there are times when it does result in death because of those injuries. So yes, it's a big problem that occurs as the elderly are remaining in their homes longer. They are electing to age in place, but yet the changes in the home are not made to accommodate for the changes that occur in their body in the process of aging. And I want to add one thing, Dara, that oftentimes family members don't pay attention to these changes. You know, if you're going home and visiting mom and you're going into the maybe the hall bath, because that's where you go, you're just going into that space that you're accustomed to going into. And not often do they enter into maybe mom or dad's personal bathroom, the master bedroom, and see that things may not be set up quite right. Because oftentimes there's little evidence that's there that things may not be going well in the bathroom. And we'll talk about that a little bit as we're going through the slides here. But Oftentimes those home visits for the holidays need to come with a little investigation going on at the same time to make sure the bathroom is really safe. I mean, there's risk for falls in the home. Well, because with 80% in the bathroom, there's 20% happening outside the bathroom. But taking a big look into the bathroom would be the thing to do to help keep your parents or spouse from injury and keeping them in their home a lot longer.
Good
So,
reminder.
yes, for sure. So look, in talking about bathroom safety, let's, you know, look at the big picture. A lot of life happens in the bathroom. I mean, we're in the bathroom all the time. It's where the day gets started most of the time when we are getting things done. The grooming, everything, it starts there. And oftentimes it ends there. As we finished our day, we've had a big day of activity, all of us. I mean, we end our day in the bathroom before going to bed. So a lot of life happens. And then it intersects our life all the time as we have those intermittent needs to go into the bathroom, So it's a big part of our life, the bathroom setting. So it's important that we really look at it. And when we're in the caregiver role, that we look at it through a safety lens from the vantage point of what needs to be done to keep my loved ones safe. And if I'm having to help or assist in any manner, what keeps me safe as well. So as an occupational therapy, that's the lane that we move in. We are about the occupation is the occupation of life. What are the things that are important to you that you need to do on a daily basis, or you need to do to have a fulfilled life? And your basic self-care is one of those occupations that intersect all of our lives. So we definitely want to make sure we are approaching it in a safe manner. So the first thing we want to look at when we're looking at bathroom safety is access. Can they get into the bathroom? So we're seeing how important it is and how it's a part of our life. So is the bathroom accessible for our aged loved ones? And when you're taking into consideration their mobility, it becomes the need to probably make some modifications to ensure that they can have access into the bathroom. As a trend in home building, the bathroom doors are typically the smaller doors in the house. Most bedroom doors are of an adequate size. Most bedroom doors are 34, 36-inch doors, whereas bathroom doors tend to be significantly more narrow. And as just in depicted in this bathroom picture, it can make it difficult for someone to gain access into the bathroom, especially if they're using a walker of some sort. And it becomes even more difficult when you have a narrow entry if that person's in a wheelchair. So some of the falls can occur with them being sort of forced to leave an assistive device outside of the bathroom door and have to hold on to different things to get into the bathroom, or that caregiver is having to be that support and bear that weight of that person as they're assisting them into the bathroom. So those are two prime areas where injury can occur. And moving to the next one, let's talk about just some general considerations in looking at probability of falls. You want to look at the lighting. Is the lighting appropriate? And this is especially at night. Or is there adequate lighting? There are those who don't want the bright lights on at night. Or the light switches may be in a location, in some houses are behind doors. They're just in odd locations where it may not be easily accessible to someone going into the bathroom. So you want to look to make sure lighting is not going to be a hindrance. Automatic lightings that come on when you do movement is definitely an option, or just having a night light that stays on in the bathroom, but definitely looking at, can they see where they're going to make sure that everything is safe. And you also want to look at the flooring. Is the flooring safe? Are there rugs on the floor that could cause tripping hazards? So if your loved one is using a safety device, an ambulatory device, as a walker, like a walker or like a rollator, those rolling seats,
Or even a cane, probably, right?
yeah, even a cane, there is a tendency for those to get caught in rugs. And even if you didn't have a device, just looking at the backing on rugs. Some rugs are just slick because there's no rubber backing. So you want to make sure that the rugs in the bathroom are removed. It's the recommendation for those who are using assistive devices or have balance problems. And another biggie is the footwear. Are they wearing adequate footwear? Oftentimes with needing to make bathroom trips, it's often done with urgency sometimes. They got to get there and get there quickly. So even at night, having to get up and find shoes or take the time to put your feet into shoes could be a problem. So sleeping with non-skid socks could be a problem, could be a remedy for night wear. And as well as when you are in general throughout the home, wearing enclosed shoes, some comfortable shoes, slipper type shoes, but with the heel enclosed, and definitely with that rubber back. Those are things that should be considered when you're looking at decreasing the fall risk in the bathroom. So now we're going into those activities that we do in the bathroom and where some of those risk factors occur. When you're looking at the grooming, it's something that is typically done in standing, and it can be opportunities for falls because there is oftentimes some bending down and bringing the head up. You just want to make sure in the grooming aspect of things that things are always accessible. And it's not often the case if that person is in a wheelchair that they have front-facing access to the sink. And so it can still be done, but there are other options for improving that, improving the level of safety, and even just the level of efficiency of being able to perform tasks, is just making some modifications in the layout of the bathroom. But the number one factor you want to keep in mind is for those who are standing, that there is adequate support there, that they can have handheld assist in the way of grab bars, that they can hold on to. Most people think grab bars are mainly for use with toileting or with bathing, but they do have a role to play in someone maintaining their balance while they're doing standing activities. And it provides definitely a one-hand hold while they're alternating using one hand to do grooming tasks. And in the same way, making it accessible to them where they can also just wash their hands and having support there where they can safely wash their hands, because hand washing is an important part of the process of keeping good hygiene, and is part of the process of completing the toileting aspect of care, that you definitely want to make sure the options are there. And in a minute, we'll talk about some other options when it is not feasible to make some of those changes that allows them to safely perform those tasks in the bathroom. And one of the biggies is toileting. What are some of the fall risks associated with toileting? The big one is the low toilet seats. Having a low toilet seat just requires so much effort to stand. If your loved one has nothing to hold on to, they're going to struggle if they don't have something. Armrests are the essential lifesaver when you're talking about getting off of a toilet. Having a device attached to the toilet is a quick fix for those who are struggling to get off a toilet. So things in the way of putting a bedside commode over the toilet, which gives you the armrest, or getting an armrest device, or getting an elevated toilet seat with armrest on it. These devices can make that transfer off of the toilet and getting on it a lot easier. It just provides that mechanism by which they have something to push down on to stand. Adding grab bars as well is another factor to consider. The grab bars come especially handy when you're doing the clothes management, when you're needing something to hold onto and really give you that support when you're managing clothes. The grab bars are definitely a lifesaver there.
And I think the grab bar also, depending on the level of strength, pushing down is helpful, but sometimes pulling up, right? So that grab bar, depending on the position of where you can put that, might be really helpful and ease for the caregiver, right? If that person's able to pull, there's less lift.
That's right. That's right. You made a point there when you said the caregiver. I want to now go back and add that part, especially when you're talking not only about the lifting to stand, even in that clothes management part. Many caregivers injure themselves because they're trying to balance a person and pull their clothes up and down and doing all of those things at the same time. Whereas when the grab bar is installed, it allows that person to stand and have that support, and it's going to allow that caregiver who has to assist them to just concentrate on the tasks that they're doing and not worrying about maintaining their balance while also doing the task. So that grab bar comes very handy at the toilet. Now the big one in the room is the bathtub. Yes. There are so many risks in bathing. The bathtub is a big safety hazard. It's sort of the big one in the room because of all of the factors that are involved in bathing, the water, the soap, and just the access into a tub if a tub is the only option in the home. Many of our aging parents have difficulty stepping over into a tub. Use of devices like a tub bench is one way of eliminating that factor. With the tub bench, it takes away the need to do a stepping over, where they can actually just sit first and utilizing the tub bench, gain access into the bathtub. Another option for those who can sit, but they have limited ability to get down into the bottom of the tub, would be to use a tub seat. Using a tub seat and having grab bars in all cases is a safety option. It eliminates the need of a caregiver from having to help assist someone in being lowered down into the tub and being pulled back out of the tub. There are so many injuries that occur with that process of getting someone in and out of the bottom of a tub. And I know, Dara, I hear that with a lot of patients. They want to soak. They want to get down in the tub and you know, you want that for your parents. They are used to it. And many of them who have maybe joint pains or arthritis, they're like, I want to get into the bottom. I want to soak. But you know, it comes a time when that's not a practical option anymore.
So question for you, the difference between the tub seat and the tub bench is that the bench aids in transfer. Is that right? Whereas the tub seat is really just to keep you elevated.
Correct.
Okay.
The tub bench, I'll just explain that. It extends outside of the tub. Two legs are into the tub and two legs are on the outside. So a person can sit first and then scoot over, and then while seated, lift their legs and continue to slide over until they're positioned in the tub.
Okay, now I understand. Thank you.
Now with the tub seat, it's positioned totally in the tub. So a person would have to step over the edge and then sit down in the tub. So the tub seat is someone who has more functional skills, more balance, more strength. They will typically benefit from the tub seat. But over time, the tub bench becomes an option for those who can no longer step over the tub, over the sides of the tub.
Okay.
And of course, that handheld shower head, that one itself can really decrease some of the workload on the caregiver, because they can aim that water right where it needs to be, and really it helps to aid in just making the task easier, really, for your loved one and for you who are assisting with that task. Now we're going to talk about alternate things to consider. As we are looking at all of the tasks that we just covered, when we're talking about grooming, toileting, bathing, and where all of the probabilities for falling can occur, we don't know where to go next. I want to present some options for caregivers. And I've put several things here, and I want to start by mentioning the tub. There comes a point when it is no longer safe. You're feeling the stress, you're feeling the strain, and they're weak, and it's just not happening easily. The bed bath has to become an option. It's where everything is brought to the bedside, and then it becomes sponge bathing or bed bathing, however you term it. But it does become an option. There are options before you get to this option, and that could be the walk-in tubs, the walk-in showers. Those types of things are options. So putting in a floor where there's no transition, where there's wheelchairs that can roll right into the stall, and an easy transfer onto the tub bench, onto a seat, is an option. And that is one that is really one of the best options there that you can really choose if wanting to stay in the bathroom is an option.
Which requires construction, right? So that's an
But it
option if you
does.
can
It
do a
does.
construction project.
Yes. You know, it can be expensive, but it's definitely worth the expense of doing that.
Well, and if you can do that, it extends the amount of time someone can access and avoids the or prolongs the amount of time before they have to resort to bed bathing, right? So
Yes.
it may be worth the investment if you have the funds so that you can continue to access the bathroom.
Yes. And another one that people opt for is a walk-in tub. It's my least favorite because there are some hazards with that. There is some stepping into the tubs. There are some things that can go wrong with walk-in tubs, but it is definitely has its place along the continuum for those who need to find alternate ways of bathing, but it does not extend into the latter stages of need. There comes a point when walk-in tubs are not safe options. And other options here that I've presented here are just for toileting. When it's no longer safe, it's no longer doable, that this option of using the bedside canoe next to the bed definitely lowers the risk of falling in the bathroom. And these other two that I put here, I wanted to address grooming a little bit more in detail. When you have a bathroom that doesn't allow for forward facing for grooming, you can really not see where the total need of your loved one is being provided for. When you can look at how can I set up a station outside the bathroom for grooming? If you can do that, you can really further the independence of your loved one versus them struggling or opting not to do tasks because it's not accessible to them in the bathroom. And these are some of the things you don't really pick up on when you're not living with a person, that they're not doing some of the things that they would like to do, but they're just no longer feeling safe at doing them. I often suggest to clients that they set up a table right outside the bathroom where they can sit in a chair, where there's a mirror there, where their little toiletries are there, where there's a basin there that they can fill with hot water that they can have and just have a modified station. It's a wonderful thing to do for that person who has a caregiver there. Like, you can set them up on the task and you can do something else. And with them seated at a table of some sort, it gives them that prolonged independence with their grooming task. And it definitely gives them an option of really getting there and getting their hands clean and really getting them to do some hand hygiene, which goes a long way in their care.
And teeth hygiene too. I know that one's really tough, right?
Yes,
Yeah.
yes. Don't let me forget the teeth. Yes, all of that. And
Yeah.
having that space there is really it could really, really change the morning routine and just really help to make things easier for everyone involved in that. And with these alternative options, it is really important for caregivers to really think outside of the norm. thinking outside of what was customary, that was the norm, that what was the way things have always been done, and really thinking through the lens of how could I keep them as independent and keep things safe, by just changing how I do things. Occupational therapist, that's our goal. It's just to show you that life goes on after injury, that life goes on even through aging, but there's a way to do it. So I'm hoping that I've shared some insight that have caused you to think, and caused you to really take a look at your home, your parents' home, and really looking at what are some things that can be changed to help keep things safe, keep you safe, and just help with the caregiving. I'm Consuela. Thank you so much.
Wow, Consuela, thank you so much. What a wonderful presentation and a reminder that bathroom safety is about safety, it's about accessibility, it's about independence, and it's about a little bit of creativity that sometimes even towards the end of life takes us out of the bathroom to do some of those tasks. And it's important for caregivers and the ones they love that everybody stays safe. So thank you so much for being with us today, for sharing your knowledge and your experience and giving us some ideas to help people stay safe in the bathroom. To hear more from Consuela, please check out her website at findingafoothold.com. And to hear more from Learn, please go to learnidaho.org/mailing-list to join our mailing list to receive our newsletter notifying you of new educational opportunities in the areas of health, wealth, lifestyle, and caregiving for aging and caregiving topics. A reminder, we have more than 100 videos in our video library now in the areas of health, wealth, lifestyle, caregiving, community resources, and technology. And we invite you to check out the channels in our video library to find a topic that will be helpful to you and your loved ones in your care. Learn Lifelong Education, Aging, and Resource Network is a nonprofit organization headquartered in the Treasure Valley of Idaho. Our mission is to help people navigate the joys and challenges of aging and caregiving. Our goal is to serve as a trusted source of information and resources delivered for the community by members of the community. And our purpose is to provide free education for mature adults, family caregivers, and the professionals serving them. Thank you so much for joining us today. We hope to see you again.